Вы понимаете по-английски? Да.
Selena, right?
Yes.
So Selena, tell us what bothers you. What should I do today?
I think that
Just a second. Have you a mirror somewhere?
Yes.
военная медицина.
So.
Так, да. Yes.
So take the mirror, take the microphone,
Mm-hmm.
and tell the audience what bothers you.
No, I think I have a problem with this,
Is the mic on?
these things.
Oh.
Yes,
Mhm.
with this. A problem, yes.
Okay.
And,
Just here in the corner of the mouth,
In the corner.
and a little bit here in the chin area,
Yeah.
that we strengthen the jawline a little bit, right?
Okay.
Okay. So I think we should start with Cutis.
Yes. Now we have plenty of cannula, but we
And
do this
the right gloves.
and gloves and everything is improving and improving. Cutis.
Okay, thank you very much. And something for disinfection.
Yes, infection.
Ich werde Cutis nehmen und Subcutis.
Können wir alles mit Cutis machen? Wir müssen Schurzen dazu.
Können wir alles
Also,
machen.
also Labium wäre jetzt sehr für die Linke, aber ich glaube, das ist schon alles.
Alles klar.
Ja, also, wenn es geht, alles gut. Ist okay.
Brauche ich eine zweite Cutis?
Noch ein zweiter Cutis.
And put down?
Pardon?
Put down? No. Like this, no?
What's comfortable for you?
It's okay.
Okay. If you want, you can lay the head a little bit for rest, at rest.
Like this?
Okay. Is that good for you?
Yeah.
Okay. So we start with the corner of the mouth. Just relax.
Difficult.
Okay. It will hurt, I promise you. No.
Okay.
So maybe start the jawline first, as a compromise. Okay. So disinfect one more time. And just start in the corner of the mouth, the small injection. Do a little bit of bolus and get retrograde and tower. It's okay for you?
Yeah.
Is it comfortable?
Yeah.
Does it hurt?
I don't feel nothing.
Perfect. So, and you see the corner of the mouth is coming up. Give it a gentle massage from the inside. Thank you. Have you been treated before in this area?
No.
No. Everything okay?
Yeah.
So now I will inject retrogradely in the fold. Just a little amount, and I will gently massage again. Just close your mouth. I think in her case, it's not the aim to bring the corner of the mouth like this up, to be very, very sharp with the other structures, because it would be too much and will enhance all this stuff and all this this tissue which is over the corner and which is aiming towards the marionette line. I think this is totally sufficient. I think it's better advised to do it for several times. If you want, we can inject just a little bit more in the lip, just to bring it a little bit up. We want that would be one more stitch, but I think then we are fine with that. So let me see. Go to the other side. And I will inject just here in the corner of the mouth. This would get bruising. It's nearly 100%. When I get in there, that there's bruising. I get here into the lip. Inject retrogradely, just a small amount. And you see the corner of the mouth still coming up. Give it a gentle massage. Just think that's sufficient. Do you see the difference between the sides? Would you like to come up for the audience? Thank you. So you see this side is untreated, that's the right side, and the left side is treated. But I advise not to over-treat this area. Okay, thank you very much. So, we do the same with the other side. Start in the corner, give it a deep bolus, and go retrograde in tower. I usually do the injection under the fold here, because if you do it directly on the fold, sometimes it gets more worse on the upper part and it lifts more and it doesn't look better than afterwards. So I also go here directly into the fold, injecting a little bit of Cutis. And I give it a little massage. So the aim of this patient is not to overdo it, not to correct it too much, just to give it a little bit of improvement. So I also inject here directly into the lip, just to raise the corner of the mouth a little bit. And also give it a massage. Can do a little bit more. So let me just massage again. Is it comfortable for you? Is it, yes?
Yeah.
Does it hurt, or is it in any way uncomfortable after the injection?
No, I don't
That
feel
it
nothing.
burns or something like that?
No,
Okay.
it's, I'm under anesthesia. I don't feel.
Okay, that's perfect. Usually the topical anesthesia didn't last so long, it's not so.
No, it's okay. It's not.
But in your case, it's okay. Okay, so if you agree with me, I'm fine with this, with the result, not to overcorrect this area. And now we continue injecting the jawline. This was waist, right?
Yes.
This was for the waist.
Well, the waist is here.
Yes, okay.
What?
Not here.
No.
It just
No.
needs something for disinfection.
I'm
Oh, okay.
waiting for you.
Oh, perfect. So we continue improving the jawline. So I inject directly here, touching the bone, injecting small amount, and you can see the tissue lifting up. Just get a little bit on the right side. You see here the elevated tissue, and I massage it. If you go directly on the bone, you lift up all the structures here and the ligaments. I continue in this, touching the bone, giving it bolus, and also a retrograde injection. Everything okay?
No, now I feel a little bit.
Now you feel a little bit okay. Now we used only 0.8 of the product.
Yes, disinfection.
This one?
Yes.
Thank you. And we continue injecting the other side. I identify the structures, touching the bone, injecting a bolus. And you can see the structures coming up. Give it a massage. You seem to be happy and satisfied.
But he is not anesthetic. I don't feel it.
Okay, okay.
It's okay.
But it's painful or it's okay?
Yeah.
It's okay.
Yeah.
So, second point. I give it a massage again. So, and now if we would have the budget of 1 ml, this would be the goal and it would be the goal to treat all these regions, the corner of the mouth, and also here the jawline. I think it would be a success to use only 1 ml of the product to save the costs for the patients. And if you want to, we can also continue. Maybe you have a look at the result, and you tell me if I should use more product or if you are satisfied with the result. Would you like to give her, Dani?
Вы поняли, вы можете посмотреть в зеркало, посмотреть, если вам нравится. Если вам что-то еще
Just
добавить надо,
give
можно
her
что сделать.
Would you like to give it a mirror?
Yes, sure.
So you can tell us if you're satisfied with the treatment or if I should improve it
I think it's
a little bit more.
very good. Yeah.
And she's also a candidate here for filling the buccal area. Probably. Who is new to the session? Are you advanced level or?
No, I have nothing about this. I don't know nothing.
Oh, you don't. So you want to be a patient, right? No, no.
I want information about this
The
product.
product.
Oh, okay, okay.
Product is very
Ask
good.
every time. You can ask every time questions about the product. What do you want to know?
What type of a product you are injecting here? I came late here.
Okay, okay. There are 3 types of product. The product is Liquidimplant, and the series consists of 3 different products. So I believe with this line you can cover the entire face. So there's a deep volumizing filler. It's called Cutis. There's Cutis for like medium folds, And there's labium, which is meant for the lips and small wrinkles in the face. So with these 3 products, you can cover the entire face. And you see there's no lidocaine, no anesthesia inside the product, and it's even comfortable for the patient. And even if you inject lips, normally if you inject lips with a product that contains lidocaine, the patient say, "Oh, what have you done to me? I feel it's swollen. How do I look like?" And you give them the mirror and they say, "Oh, it's okay." But if you have a product without lidocaine, which the series actually consists of, there is not this feeling that you have this swollen lips or swollen face afterwards. You can do it with topical anesthesia, what we did in this patient, that we just made a little bit from the outside of the skin. So sometimes words are missing in English, so I try to describe it anyway. But I guess I think that this is very good products, and you can cover everything with that. So and they only differ in the particle size, and in the concentrations all the same. It's 25 milligrams per milliliter HA, and the cross-linking rate is from high to very, very low in this product. So these 3 fillers are you can divide them by this Eigenschaften, by its abilities. Pardon?
I don't know the question. What was the question?
Oh, this was only information. Last question, you mean? No. Okay. So are you satisfied?
Yeah.
Okay.
Yes.
Or should we treat more? Should we show the cannula again?
Добавить вам чуть-чуть. She wants to add a bit of volume to
Yeah.
hers.
Where?
Show the area.
Where's the
Покажите
volume?
пальцем.
I don't know, it's up to you.
Okay. Show me the area with one. I can imagine treating here with a cannula, just a little bit, maybe 1 ml or 0.5 ml to each area, just to give it a little bit of tightening. But it won't improve the jawline that much. It will harmonize the face. My task
But
is
it's already very nice.
it's very nice. Yeah. Don't overdo this area. Okay. Show the cannula.
Yeah.
Just will change my gloves again. And somewhere I have my...
You want
I bring my
your
own.
Yeah, I know. You see the Russian doctors are so... Oh,
No.
where is it?
You're doing a good job, Olga. Thank you very much. So the next thing is I inject here on the posterior part of the cheek, the buccal area, and I will do it with a cannula. It's a 22 gauge cannula with 50 millimeters in length. And we do it this way. I just make a small insertion point, and afterwards, I think you saw it this morning, right?
Yeah.
And I will do the same thing to you, and
So very
I think we are done with them. Okay?
I can help you.
Yes, of course.
Yes.
Thank you very much, Olga. You're a diamond. So, are you ready?
Yeah.
Yeah. So just relax. I will give here a small injection. It's very tight, the skin here. It's very good. And that's it. You're too good to me. Just will remove the label. This is for the patient's record. So, see that? Here's the syringe, and you always have on the syringe the product code and the date. So before I start, I always remove this record or this for the records. And by the way, it's the only way to see the scale in total. So otherwise it's covered by the data of the syringe. So I go here in the point, and I'll just try to get my way down to the jawline, just a small bolus retrograde. It's okay?
Mm-hmm.
Okay. I will here just lose some, go a little bit forward. I will give it afterwards a little massage.
Mm-hmm.
Actually, we only inject
Mm-hmm.
0.2 ml. I inject very slowly.
Mm-hmm.
Is there any discomfort for you?
Yeah.
No, any discomfort.
It's good.
That's good. Okay. That's a problem with negotiations. So now we used 0.4 of the product. Let me see if it's sufficient. If you would like to come up for the audience. See a slightly difference here.
Yes,
That's
it's
better.
So much
It's
better.
much better. And that's nearly half of the syringe. I think
Very nice.
it's sufficient. Here's just a little bit of tissue, which I would like to elevate just a little bit, only this point here. So I go a second time into this point to correct this small depression here. And I think now we are fine. So, and we move to the other side.
Yes. Disinfection. And
I'm not used to that, Olga.
this is because in the morning was small glass, so
I
I'm
ho- I hope-
trying to.
I hope you're
trying.
for rent.
I'm trying to do my best.
So I think this side is not so deep as the other side. So the skin is also very tight in this patient. Have you ever had a treatment in this area?
Yeah, I think yes. But
Yes?
6 months before.
Only HA, or was it also threads or something like that?
Нити или только гиалурон?
Нити. Нити.
Threads also.
Oh, threads also.
It's good.
So it's okay.
Yes.
Don't do this at home. Do this at home. So where's my entry point? Sometimes it's not bleeding and you have difficulties to find the entry point again, but I think I need a second time.
Yeah. Yeah. Good.
I was too gentle with her.
Yeah. But skin is good. and
Skin is
that's
very good. Okay, should be sufficient. Thank you very much. Maybe I'm directly over a thread, an X thread.
Maybe. I don't know. It's happened. When you want to.
It's live, it's all live, so
Yeah.
could happen.
Put your mouth.
I think the entry hole is good, maybe.
Чудовищно смотри. Не бывает долгих стрел.
Да.
Now we are in. And the same here on this side. I think I feel the collagen that is induced by the
Yes.
threads.
And I feel
So I just have to go to the side because I'm right-handed. Sometimes it's a bit difficult for me. So, and I would go to the jawline a little bit, releasing the collagen of the threads a little bit. And I think we're done.
Yeah.
Would you like to come up for the audience? And maybe I need it the second time. Are you satisfied with the result?
Yes.
Do you
Yes.
see any difference in the sides?
yeah, better.
Anything? Be honest. Be honest.
Yes.
She's not paid for that. Okay. I think we're good. I think we're good.
Ниже.
Счастливая?
Да.
Another happy woman.
Yes.
Excellent result.
Thank you
Yes?
very much.
Are you satisfied? Thank you very much. So, do we have another patient?
Wie viele hattest du?
Jetzt?
Wie viele hattest du?
Ein.
Hattest du einen? Willst
Ein
du
Prozent?
noch einen?
Ja, klar. Understand anything because it's important you're the main person and it's important that you understand everything I say because I want you to treat you the way you want to. Okay? So, tell the audience what bothers you. What should I do? I'm just checking the big screen.
In your mind, for me. What
No. You tell me what to do. You're the main
She's
person.
here.
I'm just a working person.
Here,
Mhm.
I think,
Okay. That's all.
and maybe here, this one.
I think it's good. Don't overcorrect also the nasolabial fault because I think the midface in most of the cases it has no form anymore. Yeah. Don't overdo it.
This one.
Just a small
And
drops.
what about this area?
I wouldn't recommend to inject.
Because I have this one here,
Mhm.
and I don't like.
Okay. But these are very details. I wouldn't advise to treat this area. Maybe you can talk to the camera a little bit. So I would just give a summary what you want. It's the corner of the mouth, right?
Yes,
Corner of the mouth.
yes,
That's this area here.
yes.
And nasolabial fold. I wouldn't recommend that because I think we are good with that. And some wrinkles here.
Here one, this area.
Well, that's a very difficult anatomical area, and I wouldn't recommend treating there for two reasons. The first reason is me, because it's very difficult to inject there. And the second reason is you have to know that hyaluronic acid always induces a collagen reaction. So it also helps to build up own tissue. And if we do it several times, it won't look good because will get too much there, and it will look unnatural. So, in the corner of the mouth, I'm totally with you. We can do just a small drops, and I think we are fine then. It's okay?
Okay.
Like a Cutis.
Cutis. Cutis.
And needle. Needle or
Needle.
needle, yes.
Do we have also 30 gauge needles?
Yes.
Can try that.
Yes, here.
You have it, huh?
Yes, I have it. 30.
Mhm.
Yes. I have even 32.
Really? But I
And
think that's for Meso, right?
yes, right.
So what is this for? This is for, what do you lapis?
This is, now we have Cutis. I introduced Cutis. Did you see that on the picture? This is Cutis, and this is a 30 gauge needle. Usually, liquid implant comes with 2 needles. Both are 27 gauge needles, and I will try now a thinner needle, and I will show you that also this product can be injected through a 30 gauge needle. That means this is probably a lower risk for bruising. Okay, and of course a little bit more comfort. Okay, I would just remove the topical anesthesia. So, do you feel anything?
No, nothing.
Okay, thank you.
Onde é que vai, madame? Vous comprenez un peu français?
Unfortunately not.
Okay.
But that's a language I would like to learn.
Okay, you mock de moi.
Okay.
It's mean you are... как будет издеваться?
Oh,
Нет.
издеваться.
No, you joke.
Torturing her.
Torturing?
Yeah.
No, no.
No.
I
She's
beautify
joking.
you.
She's joking.
I'm afraid that you are.
No.
Okay.
Look, I used a very, very small needle, the smallest needle I know to apply this
I
product.
trust you.
Only for you. Only today, only for you. Okay. So we start also here in the corner of the mouth, and I will suggest it will elevate much more better than in the last patient. So start here in the corner, give it a bolus, and you see the product has a very good flow with a 30 gauge needle. I think I give it a little massage, a gentle massage. Just close your mouth. Thank you. Give 1 point here. And I think we are done with this side. 2 injections. Was it comfortable?
Yes.
Okay. It was a slowly yes. Okay, I will do the same on the other side. Well, actually, I only used 0.15 ml for the side. I'll do the same here. Give it a bolus and a deep, and a retrograde tower injection. And I think we are done on this side with only 1 injection point. I will give it also a small massage. It's okay for the picture? So Olga, would you mind giving the mirror again to my patient? What's her name again?
Irina.
Irina. Oh, Irina.
I think somebody here. She was just
So, would you like, Irina, would you like to come up for the audience a second time? Would you like to go? Don't touch it. Would you like to come up?
Поднимитесь чуть-чуть, чтобы остальные могли посмотреть. И повернуться к людям, чтобы они...
Are you satisfied with the result?
Как вам результат?
And yes, it's very nice.
Right
but,
answer.
Here, what it's possible to put.
No, because that is, I think that makes you beautiful. That makes expression to your face, and that makes you lovely. Really
Thank
lovely.
you very much.
Thank you, Irina.
I'm beautiful.
Great job.
Thank you very much. So, do we have another patient? Yes,
Finally. Sure.
the final patient. Please take a seat. No, you don't have to be afraid. I'm changing my gloves. Okay. So, make yourself comfortable. Make yourself comfortable. What's that in Russian? Make yourself comfortable.
Чувствуйте себя хорошо. Расслабьтесь. Не могу.
Я тоже думала.
She was thinking all day long what to do or not to do. And
I feel a little bit of adverse reaction to me. Like, I don't want to do anything. No, just kidding.
relax.
Okay, so
Просто расслабься.
what is it you desire? Tell me in Russian.
Что вы хотите?
Also the same little bit corner of the mouth.
Ну что он думает? But she wants your opinion.
Yes, I totally agree with you. You can do just a slightly amount in this area. And I would advise, if you see the lip from the side, if you turn to the audience, if you go up, like crunch. Okay. No, you're fine. Just sit. Yes, or like that. Okay, if you look straight down towards the wall and the mirror. Okay, so you see? Tranquilo.
Потому что видно, что нижняя губа немножечко. Вы просто сидите, он будет объяснять, что она чуть-чуть.
Just let me have a look at it. I think the lower lip is a little bit more retrograde than the upper lip. We could check if there is any overbite.
Ну, посмотреть вам привкус. Посмотреть.
Would you like to show us your teeth?
Чуть-чуть поиграйте, да?
Yes. And
Посмотреть на
yes,
привкус.
you see this slightly overbite, and I would like to correct just this area here under the lip. And I think if we correct this, we have a better shape from the side.
Он говорит, если мы исправим вашу форму чуть-чуть снизу, у вас будет намного лучше, если со стороны смотреться. То есть это будет эстетично и красиво. Да. То есть то, что у вас маленький прикус такой, он то исправит, чтобы это было лучше. Можно обратно ложиться.
Would you agree with that?
Вы согласны на это?
Ну, слегка.
Yeah, that's exactly what she needs.
So here's my offer. First, we start with the corner of the mouth, and
Он с уголков угла.
and-
Начнет.
and you just say it's okay. We leave it like that, and I also will use a very, very small needle for you. Okay? It's very comfortable for you, and you have less pain.
Он будет использовать самую маленькую иголочку, да, чтобы у вас меньше боли было и комфортно было. Ну и игла, это игла делается.
Where's Olga?
Oh,
The 30 gauge needle. Is there any left? Ich glaube, das sieht gut aus.
Ja, das ist echt ein bisschen change. Sag mir, wenn du es brauchst. Helfe dir gerne.
Dankeschön. Das war's, danke. Olga, I missed
You
you.
miss me.
I missed you.
I feel that. And Arash, keep talking to me.
Oh, really?
Feel that.
Arash.
Yeah.
That's not
Disinfection.
polite.
Disinfection.
Distracting
Doctors,
Olga.
Doctors are first. Anyway. Okay.
I was thrown away.
Oh, that's
Yeah.
fine.
Marketing. So we start with a disinfection. Are you feeling comfortable? Or you want to sit more down or up? Or? Oh, that's relaxed, isn't it? Start with disinfection. So we start in the corner of the mouth. I like this technique very much because the tower technique in this area, because it raises the lip very, very good. Start injection. Now it hurts. I'm sorry for that. Gently pressing and injecting upwards. And I think it's okay. Okay. Does
No pain.
no pain. That's perfect. Oh, okay. You're doing a good job. It's just my fault. Maybe from the other side. It's better.
Okay.
So we used 0.5 ml, which is very, very small dose. And I think it's good. It's already good. And you see, you can also use this product through a very, very fine needle. Just through it.
I made Jupiter 2 years ago.
Always liquid implant, right?
Hmm?
This product?
No, at first.
Okay. So, give the injection to the other side. Small bolus and retracting the needle retrograde. And you see it's a very, very good result just with a small amount of this product. And this is Cutis. I will prefer Cutis. Just like to give it a gentle massage again. Do we have a good picture?
Yeah.
Скажите, что я полностью ему доверяю, как он считает.
She fully trusts you, so it's up
Oh,
to you.
that's good. Thank you. Thank you very much. So what we do right now, I would just like to elevate this a little bit to give it a better shape from the side. Yeah? And now I'm doing very, very fine, small small injections. And it will be a little bit more uncomfortable now. Okay?
Сейчас он делает губы ниже чуть приподнимет, но она чуть болеть может.
Just some small
Я
drops
знаю.
to harmonize this area. Okay? So we'll start here, injecting, lifting the needle upwards here. I would like to, you see there's even no bleeding with a 30 gauge needle. I would like to give it a gentle massage. Try to save some product for Sabine. Okay, and I will go all the way the lip, just to harmonize it a little bit. Okay. It's okay for you?
Все.
pain. It's okay.
Is it okay? Okay. I would also give it a gentle massage. And we're treating the other side. Would you mind turning the head a little bit towards to me? Thank you very much. And I'll continue injecting on this side. Just small boluses for the harmonization of the lower lip in this case. And I think we're done. I will check the view from the side, and I see that the lower lip is just a little bit lifted and we have more harmonization. What we can do in the next step is to support this a little bit more with an injection, but I think we'll do that the next time.
Что он сказал?
Что сказал, что можно было бы еще немножко добавить сюда, чтобы придать основу губе, но скорее всего, что это будет уже лучше сделано в следующий раз, чтобы не стараться.
And we look again together in the mirror, and you tell me if you're satisfied with the result.
Зеркало, и вы говорите, если вы довольны.
Whoa, beautiful.
Oh, beautiful.
Don't touch it.
Немножко, если поднять еще нельзя? С этой стороны.
She's asking if it's possible
С этой стороны. Это хорошо.
to lift up this side.
The corner.
I think we are bad in time.
Yeah, and I think it's я думаю, что вы ну как-то падает свет, что вы не
Эта сторона очень
всё.
хорошо.
с моей стороны кажется это but
Don't
I
touch
think this one is better. She's thinking that this was, but I think that
I think it's the
the
light.
light
It's
is the
light,
difference of light.
These are just small improvements, but I think overall it looks very, very nice. And the result will come in a few days. So this product is retracting water, and it would look even better in the next days. Okay? Thank you very much.